Hello friends, in this video we will talk about parotid gland. So we will discuss introduction, capsule, relations and contents, nerve supply and applied aspect. So here you can see this diagram. I'll describe the introduction. So please note it is an inverted pyramidal shaped gland which is present between external acoustic meatus and the ramus of mandible. So it is pierced by the masseter muscle, also by the branches of the facial nerve. So a simple way to remember: temporal, zygomatic, buccal, marginal mandibular and cervical. Okay, so one of the largest salivary gland it is. If we see the capsule, how does it look? So now this is the tympanic membrane, zygomatic arch, styloid process. Remember, this entire parotid gland is covered by investing layer of deep cervical fascia mainly, that is splitting into uh, parotid fascia. So DCF is giving parotid fascia, that is the deep and the superficial. This is superficial, this is the deep. Here stylomandibular ligament, okay, and this is the styloid process. Let's see. Let us see with the relations and the contents. So first I would like to describe the relations. Okay, so before that, all right. So this will be anteromedial, anterolateral, posteromedial and posterolateral. Okay, right. So first what we have to understand, this is the pharyngeal wall. So pharyngeal wall is there. Now anteromedial, let us see. We have ICA, internal carotid artery and jugular vein. What jugular vein? Internal jugular vein. The last four cranial nerves, what are they? 9th to 12th cranial nerve, like this. So I'll give you a simple way to remember this. So just draw a triangle. The apex will be 10th. Okay, so if you're drawing it like this, this is your apex, 10th nerve. This is your medial side, 9th nerve. This is your lateral side, 11th nerve. And in between, the midpoint will be the 12th nerve. So like that. Same way, styloid process, again draw a triangle, just for understanding I'm telling you. So on top, so you'll have lateral side, again you'll have lateral side stylohyoid, medial side styloglossus, on the apex stylopharyngeus. Okay, now this is our parotid proper. Here you can see external carotid artery and retromandibular vein. That was part of our pterygoid venous plexus, is it? Is it not? Now this is the ramus of mandible, the medial pterygoid and masseter, that is on the anterolateral side. Now if we see the posterior, anyway before that, this is the entry and the exit of the facial nerve. So facial nerve is going to pierce this gland. So let us see posteromedial now. We have the mastoid process with two muscles. Posterior belly of digastric, the posterior portion, anterior portion of sternocleidomastoid. Okay, and you can also see in the lateral side, you have this investing layer of DCF. If we consider here superficial, you have the parotid lymph nodes, the investing layer of DCF, as in deep cervical fascia. This is platysma, branch of great auriculotemporal, branch can remember as ATM nerve, branches of great ATM nerve. Okay, and this is the skin. Okay, so this is to show you the parotid gland. Contents you can see from the diagram itself. So nerve supply, parasympathetic, sympathetic and sensory. This is a nerve supply. Okay, so sensory, remember it is T1, sensory is the ansa cervicalis C2 C3. Sympathetic is the T1 of the spinal cord. So for parasympathetic, I'll tell you the way: lacrimatory nucleus, 9th nerve, Jacobson nerve. Please write down this flow chart, it will be very easy. First please write down lacrimal nerve, 9th nerve, Jacobson nerve, tympanic plexus and lesser petrosal nerve relays into otic ganglion. This is for parasympathetic. Okay. Let us see applied aspect. So parotiditis is the swelling of the parotid gland, and mumps is also a part of this. So mumps is nothing but it is like somewhat a cancerous lump which will be formed in the parotid gland. Okay, you can also write one more, that is silolithiasis, that is nothing but the formation of the stones in the parotid gland. And lastly, we have the Frey syndrome. So Frey syndrome is the lesion of the auriculotemporal nerve, causes increased redness and sweating. Remember this. So first I want you to remember which nerve is lesion, auriculotemporal. What are the clinical features? Redness and sweating in the face. Okay. So references from where the images were taken. So that brings us to the end of the video. So thank you so much. I'll see you in the next video.